It's interesting because people have an impression on tests in general that they're either positive or negative. Most of medicine is not so black and white. And this is not a positive and negative test. This is a test that adjusts your level of suspicion. And it requires a certain amount of interpretation. And you need to take in the patient's characteristics. You need to take in the pretest probability. You need to look at all of those numbers when you're interpreting the test. Being burned by the test, the question is how, did you effectively interpret this test or correctly interpret this test? Did you see that it lowered the number a little bit and felt, and considered that a negative number? Because again, there are no positive or negative results. It's a continuum, and it requires interpretation.
Sometimes I will have physicians express apprehension. They'll say something to the effect of, listen, I've been burned by this test in the past, and so I'm not willing to try it again. First of all, this test does not tell you whether or not you have cancer. We don't have that test yet. It doesn't exist. A PET scan doesn't tell you if you have cancer or not. A CT doesn't tell you if you have cancer or not. Nodify also doesn't tell you if you have cancer or not. They're all different tools to help risk stratify the likelihood of malignancy in an indeterminate pulmonary nodule. And so you really have to interpret the results in that context. Nodify is not perfect. Neither is PET, neither is CT. If Nodify says that the risk of malignancy is less than 5 or 10%, you should not forget about that nodule. You should remain vigilant and repeat a CT scan in about 3 months. So in the event that Nodify is wrong, which is a rare occurrence, you're not going to completely miss a diagnosis. That diagnosis may be delayed a little bit. But that is a worthwhile trade-off from biopsying every single nodule, because the iatrogenic complications from minimally invasive biopsies are still significant when they happen to you or your family member.